Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? I am so excited to have Dr. Jennifer Levine as a world-renowned facial plastic surgeon guest on our show today. Hello, Dr. Levine.
Hi, I am so excited to be here.
Well, we're excited to have you. On our show, I mainly talk about body. So I'm so excited to have a facial plastic surgeon. We've had facial surgeons before, but we haven't really gone in depth like this. Our previous episode, we talked about facial fat grafting, nano fat grafting. So that was a really interesting episode, but we want to, on this episode, talk more about facial balancing. And you guys... So important. During this episode, Dr. Levine is going to showcase her expertise. She has done so many surgical and non-surgical procedures. She's seen a lot. So we're going to let her show us, teach us, and really guide us on how to make good decisions with our facial procedures. And you guys know I like to bring on the experts when we're talking about things that are trends. Like we know a lot of trends come and go. So Dr. Levine, you were telling me before we started recording that you just came back from Korea. What were you doing in Korea?
So I was in Korea. I was speaking at several different symposiums there. And I'm sure you know that Korea is kind of like the mecca of both like skincare and plastic surgery. So it's so important for me to kind of hear from my colleagues from around the world and also see like what's going to be the newest, best, and latest. And also, share what I do with other people. So it was a really so interesting and so fun and so different. I mean, it's a 13-hour time difference. So it's like you really feel like you're on the other side of the world. One of the symposiums I went to had people from like 26 different countries there. So I really like to kind of get out of my comfort zone a little bit, go into a different environment and kind of like hear what other people are doing and hear what questions they have for me. I ask them questions. So I find that to be like really stimulating to like kind of get out of my office, get out there and kind of see what else is there.
What's out there? So tell us, what did you see out in Korea that's like different and new than what we have going on over here now?
So I think that we're doing, obviously, and I live in New York, so we're really up to date on a lot of things, but in general, not just in Korea, but I feel like plastic surgery and dermatology in general, we're going more towards regenerative medicine and kind of harnessing our body's own potential to really rebuild our tissue so it is more youthful. So it not only has collagen and elastin, but it also behaves more like normal healthy tissue. So I kind of feel like that's kind of where we're going, whether it's with like stem cells or one of the hot topics now is also exosomes.
I've heard.
So I don't know if you know what exosomes are.
I have not talked about it on the show. So if you want to dive in, you can dive in.
So exosomes are basically like vesicles. So it's like little pouches that contain cell signaling communication. So they contain information that allows cells to talk to each other, whether it's like cells in the skin or in the extracellular matrix. So like keratinocytes, fibroblasts, those kinds of cells. So in these little vesicles are things like mRNA, which are things that like tell our cells what to do, and other growth factors and other peptides and other proteins. And what this is going to do is it allows the cells to communicate with each other and actually make them more healthy and produce things that are found more in youthful cells. So the idea is obviously, if you're just producing collagen, well, scars produce collagen. So that's not the same thing. So it's not just to produce collagen, it's to make the tissue function like it did normally. And that's really what regenerative medicine is about. It's retaining the youth and properties of healthy tissue, not just producing the things that are in it. So that's kind of one of the like hot topics now. And there's, many different ways to do that. And exosomes can come from many different sources. They can come from plants. They can come from animals. They can come from mesenchymal cells. They can come from placental cells. They can come from all. So there's a lot of stuff. But the important thing to note is that in this country, the FDA has kind of issued a black box warning, basically saying like, we are not permitted to inject these substances. We can kind of apply them topically, but in this country, the FDA has come down quite strongly saying that these substances should not be injected, but around the world, they are being injected. So
Interesting. I'm going to look more into that and maybe in a next episode, see like how and why this is happening and how the results are in other countries, because what the podcast is actually listened to worldwide. Hello, girls. I know I see you guys all over whenever I'm checking my stats. I see you, Australia. I see you, Canada. I see you, EU. So all our episodes are listened to worldwide. So for our girls that can go get this injected, tell us a little bit more for them.
So there's kind of two ways that they can be injected. So you can inject them either intramuscularly, and they can kind of provide, they're going to like kind of rejuvenate your body, or they could be injected like topically, like into the skin or into the hair. But it's really important to know, like, not all exosomes are created equal. So it's really important to know like what the source of the cells are. You want to make sure that they're purified properly. So definitely this is something that you really kind of need to do your research on, because it's not an even playing field. And there are some like great things, but you certainly don't want to get something that just like over promises and under delivers. But I do think it is important to know that this is like a real direction that you're going to be hearing a lot more about. And there's going to be a lot more talk about this. So I think it's going to become from something that was kind of like, oh, I don't know what that is. That seems like a little weird or strange, to being like, this is something that we are going to be using every day. And it's going to be part of our lives, right? Because who doesn't want to be healthier or more youthful? That's really what we're going for. I mean, that's really what I'm going for. When I want people to look better, I never want them to look strange or fake, because that's distracting in its own way. Like if you look really weird, like a child is going to be able to tell that you look strange. Like you don't really want that. You want to look your best and you don't want to look weird. So that's like my main goal.
I know that is. Honestly, I believe when women are looking for facial surgery or facial procedures, one of their main concerns is not looking like they had a lot of work done.
Yeah, I agree. I think it's actually better to have like either some of those wrinkles or look normal than to really look strange. And I think, we're so used to seeing things with like filters on Instagram, and it's important also for people to look normal when they speak and move. Like we've all seen those like Kardashian videos. They look great in a still photograph. And then once they start moving their faces, you're like, wait a second, are you crying? Are you laughing? Or what's going on here? So we want to retain, normal expression at all times.
Absolutely.
That's super important.
So Dr. Levine, our audience, my girls are between 30 to 50. So in that age range, tell us, for somebody who's coming into your office and they're starting to have concerns, like my face is starting to droop, or I'm starting to see wrinkles in my skin, what would your recommendation be for somebody who's just starting to look in the mirror and say, I'm not seeing myself the way I'm used to seeing myself?
So when I have patients come into my office for a consultation, I always give someone a mirror and I have them look into the mirror. But the mirror really doesn't tell the whole story, because the mirror is only showing your face from the front. And the mirror shows your face like actually 1.5 times smaller than it actually is. And we all, when we look at ourselves in the mirror, we kind of like fix our hair a little bit. We make a little face. So what I do for all patients is I take their photographs in the 5 standard views. So they're able to see themselves from the front, from a 3/4 view on each side, and also in profile, because that's going to show how other people see you, which is really important. Because if you're sitting at a restaurant or, you're talking to someone, most of the time we're kind of turning our face a little bit, or they're seeing us from other views. So we also go over the photographs, and I always do a full facial analysis of all patients. So we kind of like start from the top and go down to the bottom, and we kind of go over everything that we see. And this way, we kind of get a holistic view of the face, and we're able to form a plan, because I want patients to look better now, but we also have a real opportunity, especially if you're in your 30s or 40s or 50s, that you want to age better also. So that it's not going to come by magic. It's going to come by a plan. So we want to know what's going on with our face now. And we also want to know where it's going, so we can develop a plan over time. So not only are you looking and feeling your best now, but you're also going to look and feel your best over time. So that's kind of my goal, is we can kind of make sure that both of those things happen.
That's beautiful, because I've heard and I've seen my girls requesting facelifts are getting younger and younger.
Right. Because, this comes back to what we were saying before, is like, how do we feel about filler? Well, filler is really used to volumize the face, but it doesn't really do lifting. So lifting is something that either we can do surgically, or we do have like a couple of non-surgical devices that actually do accomplish some lifting, not that many, but we want to
give us the tea on those.
Okay. So when we're talking about the face has layers. So we have the skin, we have the fat pads that we all know about. We have deep fat pads and superficial fat pads, and they kind of fall down and in as we're aging. So that can lead to some changes, and that starts in the mid to late 20s. Then we have a deeper layer of tissue called the SMAS, or submuscular aponeurotic system, which is the layer that we would lift if we were doing a facelift. So this is more what's causing some of the sagging, and it's attached to the skin and also to the bone by some ligaments. And then we also have bone. So we have bony changes that occur in our face, but that's going to happen more by like the 5th decade. We're going to have some very upsetting things happen to the facial skeleton. We're going to lose bone. We're going to open the orbital aperture. So there's going to be changes that are going to be harder to compensate for. So for my patients, we want to treat the skin. We want to treat, the fat pads, and we also want to treat the SMAS. So obviously the SMAS is something that I can treat surgically, but if we're not going to treat it surgically, the treatment that really targets the SMAS is Ultherapy. So Ultherapy uses visualization of ultrasound, and it allows you to actually see the patient's own anatomy. It allows me to see where is the SMAS, and then I can treat it with targeted transducers. So the downside of Ultherapy is it can be a little bit uncomfortable, but I give all my patients little numbing injections so they don't feel it. But this is a great way to actually target the same layer that I would be lifting if I were doing a facelift. The other technology that I have that also targets this layer is something called M-Face. So M-Face works by targeting the muscle. So let's say if Ultherapy is targeting more of the fibrous tissue around the SMAS, because it's like kind of connected in this like connective tissue, the M-Face actually targets the muscles of elevation. So it targets the frontalis muscle and the zygomaticus major, minor, and rosaris muscles, the muscles that lift the corner of the mouth. And by working on the muscles of elevation, it lifts the face, because this is one continuous layer that starts from here and goes to here. So it kind of lifts everything up and kind of creates some natural volume to the face, which lasts at least a year, because we've done some volumetric analysis of that. And it's also combined with some radiofrequency, so it helps with wrinkles and also producing the collagen and elastin. So those are kind of some really great, no downtime procedures that are going to target more sagging. The world is not only treated with volume. We have other tools that we can treat the face with rather than just volumizing it.
Absolutely. I think you bring up a really good point, which is, I think in the headlines, it's been about people removing their filler because they got to a point where they were looking, what's that evil witch with the cheeks? Maleficent. They
Oh,
were giving
Maleficent.
they were starting to give Maleficent vibes.
Right.
So they're dissolving their fillers. So this brings up what Dr. Levine is saying to I'm gonna talk to my girls now. Okay. So you know how a lot of times you're starting to look at your face and you're like, okay, this doesn't look as full as it did or as I remember. So you go to an injector, you think you need injections, and they start filling your face with filler. But this is why it's so important to pick a good injector, because there's injectors that will just fill your nasolabial folds until you cannot be filled anymore. And now you have, I don't even know what to call it, but like where your folds are so full, when you smile, your animations you can't animate because that filler is so firm. So that's where you start to see those people who can't make their full expressions. It's because the filler is so firm. So years back, they started to do different types of techniques with injections. I think they have like the 6-point injection grid, the 8-point, I don't know, marketing terms might be, but also filling the cheeks at the same time, not just filling the folds. So you're adding volume into the cheeks. Well, then they started to go a little bit too much. Then they started to give Maleficent vibes. So that's what Dr. Levine is targeting with different technologies. So you're not just overfilling and filling and filling, which on our conversation before we started recording, I told her I had some questions submitted. And one of the questions was, what's your stance on filler? Because a lot of people are going anti-filler. And as a facial plastic surgeon, I would love to hear your stance on it.
Right. Well, I think that I'm not like one of these like always, never kind of people. So like some filler obviously is helpful because the first changes that we see in our face is that we lose some volume. There's a movement of the deeper fat pads of the face down and in, and that's what's going to create the nasolabial fold, the melolabial fold, and also make your under eye look more hollow. Or you look just more tired. So some correction to the cheek with a little bit of volume is going to be very pretty. But it's like, what's the expression? If you only have a hammer, everything's a nail. Like filler is not the answer to everything. So you have to kind of use it judiciously. So if there is some volume loss, then it certainly can be corrected, but it shouldn't be used to do everything. And it shouldn't take the place of lifting. So the other big trend that's in Korea, and it's here too, are obviously threads. So threads are like a great way to lift tissue. But honestly, like it's a pretty subtle result. It's not like threads really don't make you look crazy, but they have to be done properly. And I think in certain, like they're not for everyone, they're not for every patient, but in the right patient, that's actually probably better than filler because it's going to do some lifting. But there's so many different types of threads and different patterns. So again, you have to know who you're going to. You have to come up with a plan, and it has to be something that's right for you. But we have a lot of options.
Absolutely. So Dr. Levine, in your practice, do you offer threads?
Yes.
Can you tell our listeners a little bit about what is a thread? Like, what is a thread so they can understand what?
So a thread, the threads that I use in my office are something called PDO threads. So the thread is really made from the same material as a suture. So it's going to go away. And the thread is kind of has these little like hooks on it. So it's able to lift the tissue. So that's certainly good for people who have some like laxity in their lower face. It can also be used to elevate the brow, and it can also be used to like lift the cheek. So those would be lifting threads. So what happens is over time, the thread goes away, and then it actually makes your body produce collagen and elastin. Now, we've all seen those like Instagram things where there's hundreds of little teeny threads that are coming out of someone's face, and it's a really cool picture. Those are not lifting threads. Those are more like threads that produce collagen, and those are not going to do very much. Okay, they're going to
superficial line.
Yeah, they can, but I mean, we have probably other ways to do that. we didn't talk about the different types of fillers because we're still on threads. So yes, I think when I'm doing threads and I'm using the lifting threads, then sometimes you can also throw in some of the smoothing threads. They're good for, as you said, for fine lines. You could use it to define the lips. I do like them, in areas that you have wrinkles, but I'm just saying, like, I don't know that like throwing in hundreds of them is going to be the way that I would personally, do it. But it is very cool in the picture.
Those pictures do definitely spark some interest when patients see it because they're like, what is that?
What is that? Yeah.
So, okay, now let's talk a little bit about filler. I know you have a lot of experience with filler, and one of the questions that was submitted was non-surgical filler and rhinoplasty. So you do both. So I would love to hear your take on that.
Fixing the nose is like one of my favorite procedures because the nose is really there to balance the other features. And I love facial balancing. So fixing the nose is a really great way to do it. And obviously, who wouldn't want a non-surgical rhinoplasty because it takes about 5 minutes and it can produce a really profound change. It's just not for everyone. So if someone has a very big nose and they really want their nose to be smaller, well, if we're adding filler, or sometimes there's also nose threads. So if we're doing that, I'm technically not making the nose smaller. If by camouflaging a bump or raising the tip or correcting some irregularities, it makes the nose less noticeable. So that makes the face look better. But if someone has a really big nose and they really want it to be smaller, then that's really a surgical patient. So things that non-surgical rhinoplasty does really well is if like this part of your nose is really low and you would like some more definition there, non-surgical rhinoplasty is great. Also, if like your tip is a little bit down and you want a little more definition, we can do that surgically. We can also camouflage a bump. So if you have a bump, we could put a little bit of filler above it or below it and make it less noticeable. Or also, if you've had previous surgery and you've had some small irregularity, that's something that also non-surgical rhinoplasty does very well. But if your nose is very big and you want a narrow, smaller nose, then probably you should do surgery. So really, it also depends on the anatomy of the patient. Now, not to scare people, but this is a high-risk injection. So this is not for your average injector. There are vessels that are in the nose that not to scare people, but like if you inject in the wrong place are connected to the ophthalmic artery, which can lead to blindness. And the blood supply of the tip of the nose is very tenuous, meaning like it's very delicate. So that if you are not aware of what you're doing, you can disrupt the blood supply to the nose. So yes, it is a wonderful and very safe procedure if done in the right hands, but this is not like a throw-in for somebody like, oh, just throw in a little bit of filler. It's just not that way. It's an anatomically challenging area. And if there is an injector that just thinks like this is an easy, quick thing to do, then they probably don't know their anatomy as well as they should. And the anatomy in a person who has had surgery before is also can be disrupted. So you have to take even more care with those patients. So great procedure for the right patient, but needs someone with experienced hands. This is not for every injector to do.
Dr. Levine, I have a question for you.
Yeah.
How often do your patients cry when they see their results for the first time of happiness?
Well, I really tell them there's no crying in rhinoplasty because it makes your face turn red and swell. So it's like, I'm like, no crying now. But yeah, it's such an emotional experience, to see that change, especially for people who have had like a bump on their nose or something that's really bothered them for so long. To have that be gone is both very exciting and also such a relief that they don't have to think about it. But often, when you see your face different, it can be a very emotional experience either way. And it can also be a little confusing. So if you don't love your nose or your face right away, that's okay too, because it is an adjustment, and seeing yourself differently or seeing yourself swollen, or maybe you have some bruising, or, it's kind of like normal. So whatever they're experiencing, it's like we have to be aware of that, and it's okay. But yes, I always tell people there's no crying in rhinoplasty, because especially for me, like I'm one of those people that if I cry, my eyes get all swollen, my nose gets swollen. So I don't want to have the nose be swollen when we're looking at the results. I'm like, okay, let's not cry now. But
I asked because I worked in a practice where we had a amazing facial plastic surgeon and an amazing body surgeon, and I would be in both rooms, and my body surgeries never cried as much as my facial surgeries when they would see themselves for that first time. And I've seen non-surgical rhinoplasties just cry from happiness of like, wow.
It's such a relief. Because for the body, like a lot of times during the day, your body is covered, but your face is always out there. So you're always kind of like looking at yourself in the mirror, catching your reflections. So you're much more aware, I think, of what's going on in your face. And Absolutely. It's a very emotional experience to have these changes, for sure.
So tell me, we're really interested. We love talking to plastic surgeons on the show, and we love hearing everything that y'all have to say. So one of the questions I always like to ask is, what made you decide to be a plastic surgeon? And for you, on top of that, how did you decide to do facial plastic surgery versus body?
Right. So I'm someone who is always personally very interested in the face. So I was actually, when I was growing up, I like to take like art classes, and I did a lot of drawing and sketching of the face in particular. So doing portraits and stuff like that. And I grew up in Brooklyn. And so anytime I had to travel, I would be on either like the bus or the subway. So I would kind of like sketch the person who was like across from me, and then maybe I would fix their face a little bit.
Love it.
So I kind of like that. And then as I went through school, I really did like math and science because it was a great answer, and I really liked the discipline of it. I like to know how things work. I like to fix things. So for me, this kind of plastic surgery encompasses all the things I really love, because I love the face. I love aesthetics. I love creating beautiful things. I love art, art. And I also love math and science. And a lot of aesthetics is math. I know it sounds kind of crazy, but these things aren't random. So there's certain proportions that are built into our brains. So these aren't, people are always talking about societal norms and stuff like that. Well, some of it isn't societal norms. Some of it is biological norms. And we're kind of imprinted with that information in our brain. So even babies will respond to like more attractive faces. And that's not because they are on Instagram or watching TV. It's just that we have that in our brain because there's certain proportions that are associated with like healthier genes or fertility or youth or all those other things. So for evolution and for the health of the species, we're kind of primed to think that those things are better. So, and that's math.
I love that.
So there's like, there are certain proportions that are repeated not only in aesthetics, but throughout nature and in space. Yeah. So these aren't random things. They're not random. They're really mathematical and they're scientific. So
when you finished your training, you leaned more towards facial right off the bat.
Yes. Yes. Because I love the face.
I love that. I love it. And I always like to ask these questions because the answers are always very different, and I love hearing it. And I know my girls love to hear and get to know the surgeons that we have on the show. So we like to get to know you. What makes you special and what makes you different, and why should my girls or the audience go to you for surgery? A lot of it is connecting because it's being able to get to know the surgeon that you're working with and who's going to work on you and trust them.
Well, it's so interesting because there really aren't a lot of female surgeons that actually operate on the face. There's probably more that do body stuff. But when you think about people who are doing surgery on the face, a lot of them are men. And I think that's a little strange. Honestly, by this day and age, that we Not that I don't have the utmost respect for my male colleagues, because I do, but in the same way, I think women, we can decide how we want our faces to look. We know what we want. And sometimes getting their perspective from another woman may be helpful or interesting.
Absolutely.
There was just
100%.
like a study that came out in JAMA, which is the Journal of the American Medical Association, that looked at 1 million patients. And they found that women surgeons in general had less complications and mortality than male surgeons. So it's
not
just
surprised.
Yeah.
It's all girl power over here.
Ooh. Exactly. But even though we always are talking about men doing plastic surgery, most of the time, like 90% of the people that are undergoing these procedures are women. Okay. And there aren't really that many women surgeons doing this stuff, like maybe 10 or 20%. So we have a little bit of a skewing of how we're being treated. So I think it's great that the viewers can know that there are options out there, and that we can, as women, kind of adjust what we want as the beauty standard or how we want to look. And I love listening to my patients' concerns and figuring out what's really bothering them, or what do they see. And a lot of times the patient will say to me, no, I want to know what you think. And I'm like, well, I'm going to tell you what I think. I'm going to, because that's like part of this whole process. But I do want to hear what is bothering you the most, because you have to, I mean, obviously I want it to be something that I feel is anatomically correct and that I'm happy with too. But if I don't address someone's main concern because I'm concerned about something else, and that's kind of like a miss, then they're going to go home and still see that thing that bothers them. That doesn't mean that they're always thinking that the correction is the same thing that I do, but we want to get to a place where they're happy and I'm happy.
Absolutely. I've heard of this happening in body surgery, where a patient, and my girls tell me, I have one specifically that's sticking out in my brain, that she told me, we were talking about an implant removal and replacement. And her initial surgery, she said she had gone in, she got a sizing, and the doctor and her husband pressured her to go bigger than what she really wanted to. She's like, the doctor was talking to my husband more than he was talking to me, and I was the one getting the surgery. And it's something that I feel like that would not pass with a female surgeon, because I know my female surgeons, and they're sassy. And if they hear a husband being too wordy, too opinionated, they're going to say, okay, what do you want?
I would think that would be the time that the husband should probably like leave the room so you could have a private conversation with the patient, because it's really about the patient ultimately. I understand that other people need other people for, support, and if they want other people present during the consultation, that's fine. But if there's a big discrepancy, then that's something that really needs to be addressed with the patient. I feel very strongly about that. That's not okay.
Me too. I tell my girls all the time, we're not doing it for your husband. We're not doing it for anybody else than for you. So if this is not what you want, if this is not something that you're looking for or you want, or if somebody's telling you, you need to do this to your body, or you need to get a tummy tuck, you need to get a BBL, you need to get bigger implants, that person might not be the right person to be in your life if that's not something that you want.
Oh, 100%. I mean, I think you just don't want someone who's coercing you into something, especially something that you don't feel comfortable with.
And my female surgeons, they're sassy and they will put a stop to it. They'll ask the husband to leave.
That is not okay.
And the male surgeons, I feel, are a little more chill about that. I think us women, we kind of like band together a little bit. Like when we see something like it's a little bit too uncomfortable, we put we're like, this isn't going to work. And I think maybe male surgeons don't see that view like we do.
Mm-hmm. Right. I think that's why things have to change a little bit, because that's not okay for anybody. Really.
Okay, Dr. Levine, one last question, and I know it's going to be a good one, because this is a very packed question. What makes us look old?
So There is the thing that makes us look old has to really do with the shape of our face. So the shape of our face is what determines what decade you're in from like 10 feet away. So we determine how old someone is, not because we're seeing fine lines and wrinkles, but we could decide like how old someone is when they're 10 feet away, right? So basically, if babies have round faces and then teenagers or younger people have more heart-shaped faces, and then we become more oval, and then we become more rectangular or even triangular. So that shape of the face is what determines our age. So everything that we're doing with these procedures is to restore a more youthful shape to the face. And that's why a youthful face has more volume up here than down here. And that's why over volumizing this area isn't going to make someone look younger. And often we see all of these young people who have gotten too much filler and they look older. Why is that? Because there's too much volume in the lower part of their face, and that is aging. So that is what we need to look at.
That was a wonderful answer because my girls are always looking for like I know I'm looking older, but I don't know what I need to do. What can I do to make myself feel better about my appearance? What do you recommend or what's your go-to for fine lines and wrinkles?
So it depends on where those fine lines and wrinkles are. So if it's fine lines and wrinkles from muscles of expression, like it's these lines and wrinkles here, obviously the best thing is going to be a neuromodulator like Botox or Dysport or Jeuveau or Xeomin is a great product for young people. Those are the things that are going to respond, those wrinkles respond best to a neuromodulator. If it's some fine lines and wrinkles here, it could either be a neuromodulator or some of the more thinner fillers.
Okay. And for laser resurfacing or for resurfacing, what do you like?
It depends. So resurfacing depends on how deep the wrinkles are. I mean, I happen to be in New York City, so I have like a non-ablative fractionated laser that I combine sometimes with like a broadband light or something like that. And that combination is going to give a really beautiful result without a lot of downtime. I'm not like big on downtime unless I'm doing surgery. So I don't really want people to look like accident victims unless it's one thing if we're already doing a procedure, then if we could do some deeper resurfacing then, but otherwise I tend to try to get the best result with as little downtime as possible.
We like no downtime. My girls like to be back at work tomorrow.
I mean, you have to like go out to dinner or do stuff, or people want to go work out. It's just like hard to do something if you're a complete mess.
Absolutely. Well, Dr. Levine, it was such a pleasure to have you on. We talked about such amazing fun stuff. Thank you. Where can my girls find you?
So I'm at Dr. Jennifer Levine. That's my website. That's my Instagram, all the good things. So they can either, DM me or go to the website or call the office. The number is 212-517-9400. And we love to meet them. And
awesome. Yeah. And before we sign off, give our girls one piece of advice that you would give your sister, your friend, your mom, if they're looking for a plastic surgery procedure and they're just starting to look.
So I think that what they have to understand is it's a journey now. So this is not going to be like a one and done thing. So I think that we all have to understand that in order to look and feel our best, we're going to have to repeat procedures or do small things over time. So like small little like tweaks are going to go a long way. But if you think you're going to be one and done, then that's not going to give you the best result.
It's a really good piece of advice. I like that because a lot of times we do think I only have to do this once and then I don't have to do anything for a while, which is not really the case when you're trying to not just correct aging, but prevent signs of aging.
Exactly. So I want to have a relationship with my patients. I want to see them and I want to follow them, and we want them to look good now and over time. And unfortunately, I mean, I wish that we had like a magical thing that could just make everything all better, but that's not the way it is because every day we're aging. So I think the understanding that we're going to have to be like kind of like in this together. Like it's not like you go cut your hair and be like, oh, I want you to give me a haircut, but never again. I don't want to come back anymore. Like we know we're going to have to cut our hair. And we also know that we have to do a variety of different things, right? Like cutting your hair doesn't change the color, right? So you might have to put color in your hair and cut it. So it's like that idea too. Like there's multiple things that are going to make you look your best. And like your base color is not the same thing as highlights. So it's like, there's got to be a combination of things and you're going to have to do them again. It's okay. Like, it's not that we don't want things to last or I don't want things to last. It's just that I want someone to look their best and I want them to understand that it's like a process and it isn't because it didn't work or it's not good, but it's like, this is what it is. And we don't want like a total overhaul. Like I'm not trying to make people into different people. We just want to look great over time, look better and better. Why not?
That's beautiful. That was a wonderful analogy. I'm going to start using it. And thank you so much for joining us on the show today, Dr. Levine. It was a pleasure.
Yes, it was so great talking with you.
Thank you. And we'll see you again.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.